Thank you everyone who has joined us for this webinar today. We believe this is a timely topic in light of where we are in our joint quest to end the commercial tobacco epidemic. This is an exciting moment, of course, for everybody in the fight against tobacco because California has taken a giant step to protect its communities against the death and disease associated with flavored tobacco products. And we are here to talk about flavored tobacco products, what the situation is on the national level and what the situation is in California and the steps to take going forward. Well, there's a picture of me and my colleague Jamie, who has a winsome smile. My name is Andrew Twinamatsiko, as Stephanie already mentioned. I'm a senior staff attorney at the Public Health Law Center, and I have the privilege of being joined by my colleague Jamie Long, who is also a staff attorney at the Public Health Law Center, and we'll be discussing flavored commercial tobacco products in California. I would like to tell you a little bit about who we are and the work that we do. So as the name says there, we are the law and policy partnership to end the commercial tobacco epidemic. I know it's a long name. In fact, it's longer than my last name, which actually is a sentence. So feel free, please, to refer to us as the partnership because it's easier for everybody. But yeah, I think that the name really captures what we're about and our joint enterprise with the American Lung Association. And we really aim at ending the tobacco epidemic in the long run. So the partnership is a CTCP grant-funded joint initiative, the American Lung Association, the Public Health Law Center, to support tobacco control professionals in their work to end the commercial tobacco epidemic in California. Because that is what we're grant-funded to do, we provide free legal technical assistance, research, training, and analysis to help communities pass strong tobacco control policies and ordinances that are both effective, legally sound, and help them to minimize disparities. So we are located in St. Paul, Minnesota, and we are actually housed at the Mitchell Hamlin School of Law. That is a picture, a beautiful aerial view of where we are located. It actually kind of somewhat looks like this around this time of the year with the fall beckoning. It's for a significant part of the year, it's actually more white than it looks right now. So we savor the weather when we can. So you hear us talking about legal technical assistance and what does that entail? The work that we do entails doing legal research on different public health questions. We work to develop policies in how they can be implemented and defended. While we do that work, we also develop publications to inform different communities on public health law issues, especially with related to tobacco control and healthy eating and active living. And those publications are out for public consumption, so you can look at our website to see those. And we also provide trainings. The trainings can be in form of in-person presentations, or now with a new reality, virtual presentations like this one. Although we are lawyers and, well, we numerically predominant in our office is lawyers, but we don't operate like a traditional law firm with clients. Our relationship with the communities that we serve is not one of attorney and client. We provide information, education information, and not legal advice. And the information that we provide is aimed at helping the communities that we serve make evidence-based, legally defensible, and equity-focused decisions. Additionally, we do not lobby. The posture that we take when we are talking about public health is to acknowledge that equality isn't really equity. We don't believe in a one-size-fits-all, as we work with diverse communities we acknowledge the unique differences and the unique priorities, and we try to work towards making policies that are tailored to each community's individual needs in order to ensure that we are rooting out those disparities that are occasioned by policies that are enacted without taking into consideration the unique priorities and interests of those communities. And in that regard, you know, we like to talk about this in substance and what it means. Champions of equity and justice in the public health field have always taken the position that in order to assure meaningful health outcomes that are equitably distributed across all communities in their diversity and uniqueness, we have to move away from approaches that focus on particularized individual behavior. Instead, we focus on those social structure conditions that influence individual behavior. That is why it is important to address social determinants of health and seeking to achieve health equity and minimization of disparate health outcomes by adopting and effectively implementing those policies that alter environments in which people live, work, play, pray, or go to school or shop. In the tobacco context, we know that it's the pervasive presence of tobacco products and the predatory marketing of those products that create social environments, that is the retail and information environments that lead to youth initiation, sustained use and addiction, and hamper cessation in the tobacco field. But focusing solely on social determinants of health misses the bigger picture. There are other upstream factors that create these environments. And there's been now a continuous discussion about really moving upstream and talking about what have been referred to as the political determinants of health. So we should understand that although the so-called social determinants of health exist, they are naturally occurring phenomena. They are a product of policy choices that a society makes through the political process. In other words, the political process is a determinant of those social determinants of health because the political process is the foremost avenue that affects change in community. And why am I talking about this? It's because we, as the Public Health Law Center, deal with laws. And of course, the law is the main manifestation of policy choices that are made through the political process. This makes the law an indispensable aspect in our quest for health equity. And I also want to acknowledge the realities of our political system, a system that has not always valued each group of people equally or realized the long-term implications of the policies on the health of different communities, especially on higher levels of government, the federal and state governments, where particular groups are underrepresented. These are the same groups that bear a disproportionate burden of health outcomes. It therefore becomes important to leverage those avenues in the political process that are likely to be more inclusive and closer to the affected communities for targeted policy approaches that minimize health disparities. And here, of course, when I'm talking about leveraging those avenues in the political process that are closer to the community, I'm talking about local jurisdictions. California localities, the cities and counties, they are uniquely situated to provide those avenues in the political process that can be leveraged for targeted policy approaches to achieve health equity in the fight against the commercial tobacco epidemic. This is, and I'm foreshadowing what we'll be discussing. This is because I said that those communities are unique because neither federal law, no state law preempt localities from prohibiting the sale of flavored tobacco products. And that is why they're uniquely situated to champion this fight in minimizing health disparities. And so with that background, let's talk about flavored tobacco products and the challenge that they present. So flavored commercial tobacco products present an especially significant health risk when it comes to youth because of their still developing brains are very vulnerable to the very addictive properties of nicotine. We know that flavors have been used for decades to attract the youth to commercial tobacco products and to mask the flavor and harshness of tobacco. Well, in addition, the tobacco industry has marketed flavored cigars and cigarillos to young African Americans to facilitate their uptake of cigarettes. And the statistics here don't lie. 86% of youth use tobacco in California. They use flavored tobacco products. 80% of retailers are near schools. And you can look at, this pictorial represent this graph showing the use of flavored tobacco products amongst the youth. According to a 2019 youth survey, the e-cigarette use rate for the youth was 28% for high school students and 11% for middle school students. So there is a dire need to address flavors because of the effect that it has on the youth and their risk to lifelong addiction. Then there's menthol. And menthol, of course, presents a unique challenge in the flavored tobacco arena due to its analgesic effects. It masks the harshness of tobacco, and it leads to a lot of initiation. And when you even look back, when the concerns that I've highlighted above, including the youth use, led to Congress to enact when it enacted the Tobacco Control Act to restrict the use of flavors in cigarettes, but it exempted menthol and tobacco flavors. And historically, the industry's aggressive targeted predatory marketing of menthol tobacco products has led to disproportionate use of these products in marginalized communities, especially racial and ethnic minorities, sexual minorities, and the youth. Menthol cigarettes are the source of addiction for nearly half of all teen smokers. And today, 7 out of 10 African-American youth who smoke, they use menthol cigarettes. So this is a really serious public health issue that has a disproportionate effect on people who have been historically marginalized and continue to be marginalized. And so in our drive to tackle this public health crisis, we need to focus on those elements that exacerbate the disparities. So as I mentioned, in 2009, Congress enacted the Tobacco Control Act, banning characterizing flavors for cigarettes except the flavor of menthol and of tobacco. So this was a great step. And the menthol exemption notwithstanding, the Tobacco Control Act's ban on flavored cigarettes had tremendous public health outcomes. Studies show that it led to up to 43% decline in smoking amongst youth who are aged 12 to 17, and a 27% decline amongst youth who are ages of the 18 to 25. But of course, this left out populations mostly affected by cigarettes. And this has been catastrophic. Studies show that had Congress included menthol in the flavor ban, as of today, 4,700 African-American premature deaths could have been avoided. And that's tragic. So just bear with me. So in addition to restricting the use of characterizing flavors in cigarettes, the Congress brought tobacco within FDA's regulatory repertoire. So, and in granting FDA the power to regulate tobacco products, Congress acknowledged the unique health risks associated with menthol, especially the disproportionate high rate of usage in African-American communities and the historic targeting of the industry of those communities. So Congress asked FDA to determine whether the Tobacco Control Act's ban on characterizing flavors should include menthol. in spite finding that removing menthol cigarettes from the marketplace would benefit public health, the FDA, of course, hasn't taken concrete steps to remove them. And so we move on to what the FDA has done in that arena of regulating flavors. On January 2nd, 2020 of this year, the FDA issued a guidance prohibiting all sales of cartridge-based e-cigarettes that are not flavored with menthol or tobacco. This restriction, of course, applies to a limited range of e-cigarettes and flavored, that, for example, flavored e-liquid pods, including Juul and other Juul compatible products. It does not restrict all flavors, does not include e-cigarettes and all e-cigarettes, and does not apply to other tobacco products such as flavored cigars. So also, that is a failure to protect health in that regard. So let me talk about why we need a flavor restriction in light of even the public health risks that I've highlighted and the disparate impact on particular groups of people. Flavor restrictions work. Our communities have gone before us in this quest and have yielded tremendous results. In New York City, for example, New York City had 37% lower odds of ever trying flavored tobacco products, and then 28% lower odds of ever using any type of tobacco products. And Rhode Island, which was Providence, Rhode Island, which was the first jurisdiction to kind of try out flavor restriction after the enactment of the Tobacco Control Act, had tremendous results as well. So flavor restrictions are really work to minimize death and disease related to tobacco use. And with that background, I will let my colleague, Jamie, take it from me and tell us about SB-793.
Thank you so much, Andrew. So that brings us, I think, an excellent background on why there is so much room for states to act and fill in the gaps that have been left at the federal level. And that brings us to the SB-793, which is the bill title for the comprehensive flavor law that was recently passed in California. So just a little bit of background on the process for the bill. The bill author was California Senator Jerry Hill, and he had tried once before to pass a flavored tobacco ban, but was unsuccessful. So this was his second try at it. There were 64 co-authors for the bill, 43 in the Senate and 21 in the Assembly. The bill had bipartisan support in both chambers, and it was supported by all members of the California Legislative Black Caucus. So a little bit on the process for the bill. It saw some amendments in the Senate, which we'll talk about in a little bit, and was passed through the Senate on June 25th. Went over to the Assembly. There were some additional amendments added in the Assembly. And then on August 24th, it was passed with those amendments on a vote of 58-1. The Senate took up the revised bill from the Assembly and passed that 34-0 on August 28th. And Governor Newsom signed the bill the same day, and it was filed with the Secretary of State. So what does SB 793 do? Well, it is a broad ban on the sale of flavored tobacco products with some exceptions that we will get into. It covers sales from tobacco retailers, their agents and employees. And tobacco retailers means an organization that's selling tobacco products from a retail location or a vending machine. And flavored tobacco products are defined as those that have a characterizing flavor. And importantly, to Andrew's point, this includes mint and menthol within the definition of characterizing flavor. This was a really hard-fought win in the California legislature. There was significant opposition and lobbying around whether or not to include menthol, but it was included in the final bill, and that was a big victory for the bill authors and for public health. And that's a picture of Gavin Newsom signing the bill on Zoom the same day it was passed. So we're going to talk a little bit about the three exemptions that were in the bill. The first was for hookah, and this exemption was added in the Senate. Hookah and shisha sales are exempt from the general ban on flavored tobacco product sales if the tobacco retailer is licensed to sell tobacco products, if no one under 21 is allowed in the retailer's establishment, and if they comply for rules for tobacco retailers. The bill still does cover electronic or e-hookahs. The second exemption is for premium cigars. This exemption was added in the Assembly, and premium cigars are defined as those with a price over $12. So that does not cover cheap flavored cigars like cigarillos or little cigars, such as those pictured here. The law also requires a number of other criteria for a premium cigar. They must be handmade. They must have a tobacco leaf wrapper. They must not have a filter tip or tobacco mouthpiece, non-tobacco mouthpiece, and they must be capped by hand. So a number of criteria for what qualifies as a premium cigar. There's also a separate exemption in SB-793 for premium cigars sold in a cigar lounge and consumed on premises. This is essentially duplicative of the other requirement, because if you're allowed to sell premium cigars from any tobacco retailer, then you're also allowed to sell them in a cigar lounge. The third and final exemption is for pipe tobacco. This was also added in the Assembly, and it applies to loose leaf tobacco, which is defined to include cut or shredded pipe tobacco, usually sold in pouches. The law specifies that this does not apply to any tobacco product suitable for making cigarettes, including roll your own cigarettes. So this leads to the question, well, what is pipe tobacco and what is roll your own cigarette tobacco? And the law gives some direction for how to make that determination. It says that you should look to the appearance, to the type, to the packaging, and to the labeling in making this decision. And it essentially sets up three questions. Is the roll your own tobacco or is the tobacco product suitable for making cigarettes? Is it likely to be offered for making cigarettes? And is it likely to be purchased to make cigarettes? So this leaves obviously some discretion in interpretation. And just a couple of examples here to illustrate this point. On the left, don't know if you can read that, but those say cigarette tobacco. So on the pouches there, both the packaging and the labeling show that those are intended to be cigarette tobacco. So if those were flavored tobacco products, then they would not be under the pipe tobacco exemption and would not be allowed to be sold. But we know that tobacco companies are crafty at trying to use exemptions to sell their products. So the picture on the right are two different products. The first is in very small print. It says cigarette tobacco. The second on the package says pipe tobacco. As you can see, they're the same product and they're made to look exactly the same. This was used as a technique to try to get around taxes that were passed in 2009 that had a higher tax level on roll your own tobacco than on pipe tobacco. The Center for Disease Control found that some tobacco companies were relabeling their products as pipe tobacco, but were still marketing them as roll your own tobacco. So the label itself or what is written on the packaging may not be enough. You may also need to look for the appearance or the type of product. So for an example, in this instance, it's pretty clear that the product is the same product. But this is, I think, something that folks might need to be aware of when they're doing enforcement, is the temptation potentially for tobacco companies to use this exemption as they have in the past. It's also important to note that for these three exemptions, they are not furthering public health. Hookah, for example, may pose a greater risk to human health than other combustible tobacco products. And there are some misconceptions out there about hookah water, but it does not filter out toxins and indeed lets through a number of very harmful toxins. One large cigar as well can contain the nicotine equivalent of an entire pack of cigarettes, and pipe smoking increases the risk of several types of cancer, despite some misconception about the health risks of pipe tobacco. So as the American Cancer Society notes, there's no safe form of tobacco. So this chart just provides a quick summary of the products that are covered and the products that are exempt. So coverage under SB-793 includes menthol cigarettes, chewing tobacco, snuff, little cigars and cigarillos, e-cigarettes, roll your own tobacco, and flavor enhancers. And on the right are the three exemptions we've gone over. So although there are these exemptions, you can see that there is still very broad coverage, and it is a big step for public health in the state of California. The only other state that has taken a similar blanket approach to prohibiting sales of flavored tobacco products is Massachusetts, when their law went into effect earlier this year. But California and Massachusetts took slightly different approaches. For example, with the sales that are exempted, Massachusetts requires on-site consumption for those sales, whereas California allows sales directly to consumers for the products that are exempted. But Massachusetts, for its on-site sales, allows the sale of any flavored tobacco product so long as it's consumed at a smoking bar, which it defines by things like having a minimum 21 age and only having incidental sale of food and beverage, whereas California allows only those three exempted products to be sold. So some notable differences in how the two states approach exemptions to their otherwise blanket ban on flavored tobacco. It's also notable that now California is the fifth state in the country to ban menthol flavored e-cigarettes, which closes the loophole that Andrew mentioned from the action taken by FDA earlier this year. So California has joined Massachusetts, Rhode Island, New Jersey, and New York in taking this important step. So for the enforcement of this prohibition, the law specifies that there's a $250 fine per violation under the law. And it's important to note that the enforcement is on the retailer or their agents or employees. So the retailer is prohibited from selling or possessing with the intent to sell a flavored tobacco product that is covered by the law. There has been, however, some misinformation. The law does not prohibit the purchase or the possession or use of flavored tobacco product. So there's no penalty on individual tobacco product users. The penalty is on the sale and on the retailers. The localities can enforce the SB-793 prohibition on flavored tobacco products. And this can be beneficial because in addition to the fines for violations, a number of local jurisdictions also have, for example, tobacco retailer license laws that contain language indicating that to maintain your license, you also have to be following state law. So for example, Los Angeles County says the tobacco shop must comply with all applicable federal and state law, and specifies a number of penalties that can apply if a tobacco shop doesn't follow state law, which can include even removing the retail license. So can be some strong incentives even at the local level to follow the state law above and beyond the $250 fine. So that brings us to the referendum, which folks I'm sure have heard of. The referendum is an initiative that is allowed under the California Constitution for voters to put up a law passed by the legislature for a vote. And there were three California voters who filed a referendum petition against SB-793 on August 31st. Now it is their task to gather 623,212 signatures of California voters to qualify the referendum for the ballot. That is 5% of the 2018 governor vote total. That's how that number was reached. If the effort is successful, then the law will go on the 2022 ballot. It won't go on this year's ballot because the timeline doesn't line up. So it would have to go on the next general election. Unfortunately, that would mean that SB 793 would be suspended for those 2 years until there is a vote on the referendum in 2022. And somewhat counterintuitively, a yes vote is the position that supporters of SB-793 are taking. You can think of a referendum as a thumbs up, thumbs down on the law passed by the legislature. So a yes vote would affirm the law and a no vote would reject the law. And here's a timeline for thinking through how the referendum process plays out. As I mentioned, the law was enacted on the 28th. The referendum was submitted on the 31st to the Secretary of State's office, to the Attorney General's office. The Attorney General then had 10 days to come up with a title and short description of the referendum, which he did, and sent it over to the Secretary of State's office on September 10th. So it has been cleared for circulation for signatures since then. It's our understanding that signatures are actively being gathered across the state. Now, the signature gatherers have 90 days to collect those signatures and then turn them into county election officials. There was some confusion about when that 90 days date applied. The Secretary of State's office at one point had a December date incorrectly listed on their website, but they have since corrected that. Also, the 90 days lands directly on Thanksgiving. And so under the law, it would go to the next work day, which is the following Monday. So that's November 30th, which is the deadline for signatures. If the referendum qualifies based on those signatures, which is a process that the Secretary of State goes through doing a random audit of signatures, then as mentioned, that would go on the 2022 ballot. If it does not qualify, then the law will go into effect on January 1st of 2021. If the referendum moves forward, then in 2022 of November is when the vote would occur. And if a majority vote yes, then the law will go into effect 5 days after those results are certified by the Secretary of State, which would be in December 2022. If there are more no votes, then the law is rejected and doesn't go into effect. So there are requirements under California state law to publicly file the chief backers of a referendum effort. And so that public filing has been made. And the two chief backers of the referendum effort, no surprise, are tobacco companies Philip Morris and R.J. Reynolds. Also, the three individuals who filed the referendum all had ties to the tobacco industry. One was legal counsel for R.J. Reynolds. A second was lobbyist for both the Vapor Technology Association and the National Association of Tobacco Outlets. And the third was a lawyer who had attempted to challenge Oakland's local flavored tobacco policy. So it's clear who's behind the referendum effort. And these funders will have to be disclosed to every California voter at the time that they receive the petition for signatures. So the signature process, the industry is likely to spend millions of dollars trying to gather these signatures. They have to be wet ink signatures, so they have to be physical signatures. They can't be virtual. And they must be signatures of registered California voters, and those signatures must be in the county where those voters are registered. According to some research that was done by the Campaign for Tobacco-Free Kids, the industry has $1.1 billion in revenue to lose on menthol cigarettes alone before November 2022. And unfortunately, 37,000 kids will start vaping in these 2 years if the referendum goes forward. So there's a clear financial incentive, unfortunately, for the industry to delay moving forward with this law. We've received some questions in other presentations and ahead of time here for what organizations can do with regard to supporting or opposing the referendum. And so thought it would be helpful just to share this information for those that are funded by Proposition 99 or 56 funds. Public funds cannot be used for lobbying. And these examples are pulled directly from the Rules of the Road publication, which is put out by California Tobacco Control Program. So lobbying includes promoting or influencing support or opposition for a ballot measure. So two examples that they include in this publication. One, an example of advocacy that would be appropriate is neutrally analyzing the pros or cons of a ballot measure. An inappropriate lobbying example would be placing paid advertising that would urge a yes vote on a ballot measure. And the CTCP mentions that if you're unsure with if an activity is okay to pursue, they suggest contacting your program consultant. The referendum effort is not the first time we've seen in California efforts from industry to use this type of approach for delay. In 2014, the California legislature passed a ban on single-use plastic bags. The plastics industry backed a referendum effort that was eventually defeated by voters who supported and approved the plastic bag ban, but it did delay the implementation for 2 years from 2014 to 2016. And the bail bond industry has been taking a similar effort after California passed a cash bail a law to phase out the use of cash bail in 2018, and that will be on the ballot this fall in November. And with that, I will turn the presentation back over to Andrew.
Great. Thank you, Jamie, for that part addressing SB-793. A lot has been covered by that. And so it brings us back to what does this mean for the momentum that has been going on for years now in California towards restricting the sale of flavored tobacco products. As Jamie mentioned, this law is not preemptive, so it will not impact the 99 California jurisdictions that have flavor restrictions. These restrictions cover now 25% of the state's population. So everything is good. It just sets minimum standards for tobacco retailers, and localities can go further and restrict all flavors, closing those loopholes. And in fact, just like Beverly Hills and Manhattan Beach have done, restrict the sale of all flavored tobacco products. In fact, we listed out different communities here in California that go have more comprehensive flavor restrictions that go further than the state. So it doesn't affect any existing laws restricting the sale of flavored tobacco products. So as I mentioned, the SB-793 sets the minimum standard, and localities that haven't adopted laws restricting the sale of flavored products can go ahead and do that. And in addition to that, close the loopholes that Jamie highlighted: hookah restrictions, hookah exemptions, premium cigars, and pipe tobacco. And as Jamie highlighted, that could also be manipulated by the tobacco industry. So it is really important that local jurisdictions, the jurisdictions that I mentioned, really play an important part in achieving health equity for their communities, can actively take a step and close those loopholes. And the idea here is that the restriction on the sale of flavored tobacco products, at the heart of it is achieving public health outcomes for all populations. Tobacco is the single deadliest consumer product. It is the only product which, used as directed, will kill you. And it nationally leads to almost 500,000 people dead every year. And so there is no safe form of tobacco use. And what flavor products do is to initiate use, sustain addiction, and hamper cessation efforts. And so there is no social utility to letting these products on the market. Every argument that could be made is outweighed by the health consequences of the presence of these products in the community. And further, as I highlighted prior, exemptions entrench inequities. And this is really important because the California legislature made the choice to lead the state towards a path of positive health outcomes. But as Jamie highlighted, there are products that are left out of that journey towards reaching positive public health outcomes. The unfortunate part is that these products, especially hookah and pipe tobacco, they are disproportionately used by particular communities, and they could be manipulated by the tobacco industry to perpetuate the same health crisis that we're trying to fight. And so in being content with the status quo and leaving out those communities behind, we are entrenching, we'll continue to entrench inequities. And even more to this point, we have time to work towards on the local level to keep working towards building further momentum in adopting local policies. And in the long run, if, you know, we currently 25% of the state is covered by local restrictions. If by the end of 2021, we've built on that momentum, a bigger percentage of the community will be covered, and this will create more momentum for more support for the state referendum. So how do we achieve this? And we've put out model ordinance that puts together provisions that embody the best practices and evidence-based options for communities to restrict flavor restrictions. And as highlighted here, the restriction has to cover the entire jurisdiction. Do not leave out menthol, because menthol is a serious public health catastrophe and it should be captured. Include all tobacco products. No retail exemptions, because as we mentioned, exemptions entrench inequities and we do not want to do that. I want to talk about the tactics that the tobacco industry continues to use to this day to derail policies on the local level. The one that has always been used is litigation. And we've seen that on a national level, starting with Providence, Rhode Island, to New York City, to Chicago, to Edina, Minnesota, and in LA County. And the argument that is typically used here is that federal law preempts local restriction of flavored tobacco products because that is the preserve of the FDA. But every court that has handled this case has concluded that federal law preserves that local power. But that notwithstanding, we've had years of precedent in this case, but the tobacco industry keeps using this. And we've seen that also in San Diego. But fortunately, the court in the LA County case ruled that even though LA went even further than all the other states that have, all the other jurisdictions that had adopted a flavor restriction, its authority was preserved under the Tobacco Control Act. So communities shouldn't yield to these threats to chill the momentum on restricting the sale of flavored tobacco products. Then local referendums. I mean, this is not the first rodeo for R.J. Reynolds and Philip Morris in restricting, in trying to derail these momentous public health milestones. We know that when San Francisco adopted a flavor restriction that was really comprehensive and included menthol, R.J. Reynolds spent a lot of money trying to overturn that, but it heard the message loud and clear when the voters upheld the flavor ban by 68 to 32%. And so there is support for these policies, and the tobacco industry is not going to relent. And so, but we have both precedent on the litigation side and the referendum side on the side of tobacco control. And one thing that I would encourage our partners and communities to know is that there are resources that the Public Health Center, the Public Health Law Center, and other TA providers have developed to educate and reflect the best policies, the best practices in the restriction of flavored tobacco products. These resources are available on our website, so please feel free to visit us. And yeah, it captures a wide range of things, including most recent resource that actually contains most of the information that we've shared on what the flavor ban means and what the referendum means in California. So please visit us and reach out to us. Here's our contact information. Just reach out to us and we'll be able to give you the technical assistance you might need to keep working at fighting the commercial tobacco epidemic. So thank you. And now, with that being said, we have a few questions, and I will be sifting through these questions, and me and my colleague Jamie are going to try to answer them as they come through. Jamie, I'll have you answer this one. What is the best way to mitigate the unfortunate situation of exemptions for hookah and shisha? What are strategies for restricting or minimizing the exemption?
Thanks, Andrew. That's a good question. So first, we should note that hookah does have significant health issues and health equity issues. Andrew highlighted our publication, which we put out about the importance of including hookah in any tobacco flavor restrictions, and I'd encourage you to take a look at that. But that includes some important statistics, like, for example, 9% of California high school students report using hookah, so this is a problem for youth. There were some arguments made at the legislature that hookah is only used by adults. That's not true. And also there's higher usage in many communities of color for hookah, in particular the Hispanic community. So one option, and the ideal obviously, would be for a local jurisdiction to move forward with including hookah in their flavor ban. As Andrew noted, there's no preemption, and so localities can go above the state law. If a jurisdiction, for example, wasn't able to go as far as that, then they might want to consider other options that could restrict where hookah is used. And one common form that's taken is the type of retailer that is permitted to sell flavored tobacco products. You could restrict that. Often that's been done based on food or beverage sales. So for example, the state of Massachusetts, they limit the tobacco bars to only incidental food and alcohol revenue. That's one approach you could take. The city of Oakland has banned food and alcohol sales for tobacco retailers selling flavored tobacco products. And the city of Chicago uses an approach where you cannot have a food or liquor license if you're going to sell flavored tobacco products. So those might be a few examples that you can think of, or we'd be happy to work on technical assistance for individual cases.
Great, thank you, Jamie. And there is another question here. Can you please give communities ideas on how to structure and fund enforcement of this bill if they do not have a TRL fee passed in their county? And I'll try to address this one. So really, adopting and implementing and enforcing a tobacco retail license is the best way to do this. I don't think that there are other alternatives to adopt a meaningful implementation and enforcement process without having a TRL in place, because it's this tool that you can leverage to ensure compliance with different requirements for communities to comply with the law. And you can't really rely on the fees that could be the penalties that could be imposed on that, because we know that retailers could decide to take the risk and use that as a risk of doing business. And so, and in addition, you need to educate the enforcement apparatus to in order to figure out how to enforce it. And so I don't know that there is any good way of going around the TRL. The tobacco retail license is the best way to go through that. And in adopting the tobacco retail license, you could factor in the cost of implementing and enforcing different facets of what is regulated. And that could be factored into the amount that the fee will carry. And so you have to, I think the best practice would be to itemize what it's going to cost and figure out the number of retailers who will be affected and use that fee, that calculation to set the fee in order to effectively implement it. There is another question. So let me see that there is a concern and fear here, and Jamie, I'll let you take this, that if we get flavors banned, tobacco companies will continue to sell the same product with new wrapping, new name that is also youth capturing. They will use like lighting, and I think this is meant to capture the ability of the industry to morph into different ways to circumvent the restrictions. And I think you kind of touched on this when you were talking about the industry's manipulation of pipe tobacco to use it as roll your own and that stuff. Could you address how communities can ensure that the industry doesn't manipulate flavor restriction?
It's a good question. So on the one hand, there are the concerns like the ones that we highlighted, where a tobacco company might try to use one of the three exemptions that are in the law to change a product or modify it in some way. But some of the trends that we've seen in other states, for example, the example you cite, giving a product the name Lightning or something along those lines, that won't get around the definition of characterizing flavor, which is in the law right now. And that's a really good definition, very similar to the model that we've used for the Public Health Law Center in our models. And it includes any flavor that provides an odor or taste. And so, and it lists examples like mint and menthol and vanilla, other flavors, but simply changing the name on the product or changing the description or packaging or something along those lines is not going to be enough to get around that definition.
Great. Thank you, Jamie. So there is another question here, and I'll try to answer this one. The opposition is arguing that the flavor ban, including menthol, is racist. While the possession of menthols wouldn't be criminalized, the opposition is arguing that there is a risk of creating an underground market that will give police new reasons to lock up Black males. How do you respond to this? I think this is a great question, and it's not really unique to that community. This is one of the things that the tobacco industry, the fears that the tobacco industry seizes on to act as if they're benevolent and they're acting in the best interest of Black communities, yet appropriating Black culture and targeting those communities and flooding them with deadly products to say and turn around and say, well, we don't want police to attack African Americans. I think that is a red herring. From the discussion that we've had, we know that tobacco is the single deadliest consumer product. There are a lot of Black dead bodies under the tobacco industry. And this idea is very disingenuous. And African American communities have been left behind in this conversation on achieving public health outcomes that minimize the rate of youth and of use and death from tobacco products. And so we are being left behind, and Black communities need to be brought within the fold. So the argument that, oh, illicit trade and police encounters is just a red herring. There have been communities that have developed that, and they can't point statistically to where that is relevant. So I think the primacy of the conversation, I think the count in that conversation is to really bring out statistically how, we pointed out, I pointed out in our discussion, how when between the passing of the Tobacco Control Act in 2009 and today, 4,700 African-American lives, premature deaths, would have been prevented. That is statistically accurate. And that outweighs, the health argument outweighs any fantasy that the tobacco industry can come up with. And so this is a public health crisis, and we need to bring Black bodies within the fold. So there is—
I think we have time for one more question.
Okay, one more question here. Let's see. Jamie, I think you touched on this, but I think there is more clarification that's needed. They say, when you say localities can enforce, does that mean they don't have to? Do local municipalities have any leeway?
Right. So that's a good question. So certainly localities have enforcement discretion and are not required to do enforcement, but they are able to, and certainly we would encourage them to. And the TRL might be a good approach. If a location has one, as we mentioned, you could make sure to include that you have to follow state law. But yes, the answer is that there's no requirement for local jurisdictions to enforce.
Great. Well, thank you all for joining us. We have a few other questions in the queue, but we are out of time, and we will make every effort to respond to all the questions that have come through. And as Stephanie mentioned initially, this webinar has been recorded and will be sent out with the slides and everything. So thank you for joining us, and keep fighting the good fight.